Now the next speaker is none other than Bharti Kashyap. She'll be talking about Femto, how Femto is better than Zepto. Over to you, madam.
Okay, thank you so much. So, good afternoon, everyone, and my topic is Capsulorhexis in Intumscent white cataract, the Femto way. Why does anterior capsule tear and the Argentinian flag sign occur in Intumscent cataract? There is a high interlenticular pressure with the pressure gradient, forward bulging of the anterior capsule, and whenever there is a nick in the anterior capsule, there is a certain scrutiny of the fluid with centrifugal force, and there is a pressure from the posterior compartment, and there is a radialization of the tear. What is the advantage of flags in this? There is a high lenticular pressure, there is a forward bulging of the anterior capsule. When we do flags, there are multiple fast circular perforations in a closed chamber and squirting of fluid from multiple points, and this results to complete circular capsular opening, and if it is incomplete, then a drip and blue stain guided CCC completion. See here, in a closed chamber, there are multiple circular openings and squirting of the fluid from the multiple points. This is very advantageous, and this prevents the Argentinian flag sign. So this is a level 1 evidence that flags has the advantage of creating a circular and optimally sized capsulotomy in case of white cataract. The release of white milky fluid during femtosecond laser delivery is the most important factor affecting the creation of the free-floating capsulotomy. Multiple simultaneous fast perforations with multiple point squirting of fluid is the best advantage of femto. The closed chamber with no pressure gradient and the triple blue guided completion is when it is required. Choice is yours. So what is the jump of cost? From ECC to phaco, 2,000 times. Did you not opt for phaco? You did. So the same way, the phaco to flags is only 20 times. Any technology has higher cost in the initial stage because of many factors. As the technology becomes more widespread, the cost of the consumables reduces significantly. The same will happen with the cost of PI. Nowadays, there are several common platforms where any surgeon can hire the facility of this technology without investing in this, so the cost can come more cheaper. So
Luminescent cataract with
this is
of
the
perception of light in the left.
This is the this is the experience of India's one of the topmost surgeon of the first case in the Zepto. Yes, this one play.
A Zepto Capsulorhexis and proceed for.
This is our first case. See what is happened.
Suction radial manipulation. Care was taken to place it carefully, onto which gentle suction was applied, which was visible as a lightning flash. Simple. This was the first time I was using a Zepto for a Capsulorhexis, and it was being demonstrated. I was told that the suction. I put in a second instrument and tried to break the suction. However, that was not possible. Dangerously at the 6 o'clock position, tubing, and lo behold, this was visible with the gush of fluid and viscoelastics through the side port. The vacuum was released, and to my relief, I was able.
So this technology also has some inherent complications which we should know. Now some humor.
अरे एक प्लेट बिरयानी दो यार। और सुनिए बढ़िया बढ़िया लेग पीस डालना हैं? लाइए, ये लीजिए, थैंक यू। अरे बड़ा कमजोर लेग पीस है। इस मुर्गी को पोलियो हो गया था क्या? अरे 5 रुपए में क्या हाथी का लेग पीस मिलेगा? चुपचाप खा ले। ठीक है, ज़्यादा ताव मत खाओ। बट कमजोर है लेकिन है बहुत बढ़िया। क्या हुआ भाई? दरअसल हम जब भी हिचकी ले रहे हैं, अच्छा, कौवे का आवाज आ रहा है भाई। क्या खाए थे? दरअसल हम 5 रुपए वाला चिकन बिरयानी खाए थे। 5 रुपए वाला चिकन बिरयानी? भैया वो कौवा बिरयानी है। अब खाइएगा कौवा बिरयानी तो मोहम्मद रफी जैसा आवाज थोड़ा ही आएगा कौवा बिरयानी
Have some fun of OPL. Thank you, thank you. So I invite Dr. Kudlu for the expert opinion.
Yeah, there are two different technology altogether actually fighting. But if you ask me for my first question to Dr. Sujay, what you showed the photo of Visumax. Actually, Visumax never do a femto cataract at all. That is purely a refractive machine. It does the only lenticle extraction. It never touches the anterior capsule. There is the one point I just wanted to clarify. There are only four equipment in the market. That is, one is a Lensar, other one is Lensex from Alcon, and also from one is from J&J, that is Catalyst, and Z8 from Zimmer. These are the four machines which does the femto, as far as I know. Volume, but these femto machines compared to the femto of the refractive surgery, which is smaller. I do have got a Lensar machine which I can move from one OT to other OT very easily. Only one person can. Smaller machine. But apart from that, whatever my argument with you, of course, as far as the capsulotomy is concerned, Zepto may do the good job. But when you tell the patient, when you opt for a very premium surgery, always you need to have a perfect goal. That means along with the capsulotomy, if you are the patient already having a grade 4 cataract intumescent, sometimes when you do with the phaco, the chances of nucleus may drop down. But if you do with the femto along with the capsulotomy, then all the nucleus will be divided, and the overall surgical time and of course the quality of the surgery also will be there, and also you are going whatever the intended result, that is with the whatever the best lens you opted, you can put. I am not telling that with Zepto you can do good phaco, but there is a chances of complication might be very high whenever there is a grade 4 cataract with the intumescent. There is one possibilities. So thinking on the account, if you think about patient, of course money might be little definitely it is much expensive. Here you need not have to invest per packs, only have to give. But if you're talking about quality, I think my personal view is definitely Femto has got an edge over the Zepto. If you are doing with a group practice, suppose there are a lot of places, 20 doctors together, they put a Femto, then I think it works almost similar to the Zepto. This is my view. Of course, for Capsulorhexis, both of them work well, but Capsulorhexis not at the end of the surgery. Then we have to proceed with the phaco. That is the main part. Suppose if you are having grade 6 cataract, just do Capsulorhexis is not so sufficient. You need the nucleus also to be managed well.
This is for intumescent white cataract. So
White cataract.
Yeah,
If you ask me,
white cataract.
intumescent white cataract. In fact, intumescent white cataract with the hard nucleus inside also, my preferred will be Femto. Yeah.
So thank you, Dr. Kudlu. Our third topic
May I
is...
add one thing? Even while doing a femto second laser-assisted cataract surgery or Capsulorhexis, if there is a intumescent cataract with high intralenticule pressure, the moment the first few shots goes, the capsule ruptures and fluid comes out from the lens into the anterior chamber, and immediately the depth is little different. You see, so many a times you'll find that you have to be very, very careful. You have to increase the amount delta that is above the capsule and below the capsule so that you get a proper this thing, because after repetition it might become all right. So you have to be very, very careful while doing femto also. And in Zepto, if there is a shallow chamber, you have to be very, very careful, and it is not only the insertion, even the removal of this Zepto is risky. But then if you compare both these, both are good.
Sangman sir?
Yeah, I just want to say that other than both these two techniques, the manual technique, if you are skilled and if you can manage, is not a bad idea, because both of these add additional cost to your surgery. So those of you don't have those devices, doesn't mean that you can't do a good surgery.
the only issue here is if you're going for a premium IOL, toric IOL and all for IOL placement, you need a proper access. So that's the only issue. If it is a monofocal IOL, you can go with manual.
So nobody is talking about the cost.
Well, that's what I'm saying now. See, you have to, first of all, you have to have these devices in your practice. Then is the question of choice comes.
Femto is accessible to very limited surgeons.
Absolutely, absolutely. Very, very limited surgeons, and I think it's a much more costly surgery.
Yeah, so you can send those patients to us, no problem.
So our